I'm Dr. Cameo Carter, board certified pediatrician and mom of 3, and thank you for joining me at the end of the day. On this podcast, I talk about kind of the intersection of life, my work as a pediatrician, the things that I'm talking about with my patients, the experiences I'm having as a mom, as a doctor, and as a woman. Today's topic is something I'm reflecting on after I had a conversation with one of my patient moms who I've known for a long time. She has a couple of older kids and recently had another baby. And she was talking about experiences with doctors, and we were reminiscing. She was talking with one of her older kids and showing them videos of when he was born and being in the hospital. And she said, we heard your voice and then we saw you in part of the video. And it was so fun for him to see his doctor when he was a baby. And this is still his doctor today. And we just thought that was such a fun thing to remember. And she said, you've been with us through so much. It's so hard to find doctors who care anymore. I'm so glad we still have you. She was being really appreciative. Her comment really touched me. It was warm. It was wonderful to affirm that relationship that we have, but it was kind of heartbreaking at the same time because I know what she means. And I also know that it's not that doctors don't care anymore. Doctors, I think, really do care. We care a lot, and I don't think I'm an exception to that. It's just that it's gotten so hard to practice medicine in a way that shows how much we care. So I no longer go to hospitals anymore. I used to, and for a great part of the first part of my career, I did. And it was so great to be able to be with patients and families in those early tender times and to walk them through their early questions and to develop that relationship. I really enjoyed it. With time, doctors are having to see more patients and cram in more visits in order to try to be able to survive and to be able to keep our businesses running. Doctors are paid less than they were when I first started my career. And the amount of time that it takes to go into a hospital, to drive there, to park, to navigate in, to see a couple of patients, and then still see all of the patients that you need to see during the daytime makes it more and more difficult for pediatricians who are in private practice to be able to do this. So there are some that are still able to do that, but for many private practice pediatricians, newborn visits are done by the hospitalists, by the newborn services that are running the hospitals. And from an efficiency standpoint, it makes a lot more sense. They're seeing lots of babies. That's what their day is filled with. And it's really hard to combine the newborn aspect as well as combining all the clinic visits. But that's been a bummer. That's been something that's been one of the things that have been a byproduct in how we've had to change the way that we do things. But it just isn't feasible to do it all anymore. And the business part of medicine in some ways took over kind of the heart of it. And we see that happening in so many different ways. The hours that the doctors are spending dealing with, all the documentation, the portals, the insurance fights, times that used to be spent more with patients. And again, that volume that we have to see makes it just impossible to fit everything in. And so to patients, it might look like doctors are distracted or detached, but often we're just being really pushed and stretched past human limits. So I think there's a lot of things that are making it very difficult. And so you've got that just kind of actual structural physicality of not being able to do all the things that need to be done in a given amount of time. But there's also changing ways that patients and people are interacting with doctors, which make it difficult. And I will emphasize that by and large, the interactions I have with my patients are just lovely and mutually respectful, and really collaborative. And I really value that and appreciate it. But the tone has changed as a whole. I think there are more people who are not entering conversations in a respectful way with their doctors. There's more lack of trust of physicians. There's the constant questioning of expertise. Doctors train for decades. We make huge sacrifices and oftentimes are being treated more like customer service reps instead of being healers and going in and trying to be able to fix situations. The burnout, again, isn't from caring. It's from sometimes caring actually too much in a system that really doesn't care for us as physicians. There's so many stories of doctors getting yelled at, second guessed, sometimes even abused, whether it's online or in person. And I think there's a difference between having discussions and asking questions and wanting to understand why, with this kind of blatant disregard and disrespect, which doctors are having to face more and more. And again, it's super disheartening because so many of us went into this field because we wanted to make a difference. And we still do. So I think an important question to ask is, maybe it's not the doctors that aren't caring anymore, but how do we keep caring in a system that's just making it nearly impossible to do so? So I'm not trying to place blame here, and I think that there's so many things that everybody can do to try to make sure we are being warm and collaborative and understanding that most of the time we're working towards a common goal of wellness, of health, of healing. And how do we navigate this in such a broken system? So I think there's some things that we can do, and some of them are very specific and some of them are maybe more philosophic, and then we have to take those philosophical approaches and figure out how to break it down individually and make it happen. But I think for doctors, we have to, whether it's a mantra or something that we do every day to reclaim our purpose and to make sure we are holding on to our sense of self in a system that isn't designed to do that. And we have to make sure that we're setting boundaries. I think many doctors go into the field wanting to help everybody, and they're continuing to give until there's lots of burnout, which is one reason so many doctors are leaving medicine. So figuring out, where we can draw those lines, and that's not something that I know at least my generation of physicians was really great at doing. We need to make sure we're saying no to unrealistic demands that compromise our care, the care that we're giving, or our mental health. And we need to be fighting back on a level that is standing up to whether we're working in corporate medicine or even in private practice, where we're telling insurance companies that we won't stand for what they're doing, that we are going to claim what we need and when we need to do it. And this is really hard because the system is not designed for that. But we have to keep on thinking of ways to be creative and figure out how to circumvent the system, because the system is definitely not designed with patients and with doctors at the heart of it. We need to support our colleagues. We need to make sure that we're not throwing other physicians under the bus, that we're understanding that everybody is doing the best that they can and are under different kinds of constraints. And we are going to do the best we can in the moments that we're in. We need to stop normalizing burnout. We need to make sure we are respecting others' boundaries and making time for that rejuvenation process. And we need to explore creative models, looking more at direct practice care, looking at concierge care, collaborative teams, different things that we can do, again, that are going to work better for doctors and patients. I think for patients, there are some things that we can do also to help the system better. And I think the first thing is remember your doctor does care deeply, even when it doesn't look like it. And it doesn't mean that every doctor-patient relationship is going to be a perfect match. If you don't feel heard, if you don't feel listened to, then find another doctor. I think understanding that you have that volition and right as a patient to be heard, even in a system that makes it very difficult to do that, is really hard to do, but it's really necessary. Make sure to express appreciation. If you have a doctor that you trust, tell them. It really matters. For the amount of frustrations that we're working throughout the day, just a couple of words of positive affirmation or thanks really, really goes a long ways. And it, I think, is a reminder in what are sometimes really dark days of why we went into this field. Be kind to staff. They're carrying the same stresses that the healthcare system is burdening everybody with, and they're doing their best. Sometimes we all feel like we're running in circles with one office telling us something and insurance saying something and the pharmacy saying something and nobody's saying the same thing. And it is so frustrating and it's easy to lose patience. But sometimes the person that's most easily accessible is the one that bears the brunt of it. And I know front office staff in many places do. And it's really hard for them and demoralizing. And ultimately, they're there working for you too. So be appreciative of them. Be kind to them. It's a really stressful situation to be in the front office sometimes. And advocate with your doctors, not against them. Support systemic reform. And so working together to say, okay, well, this is what I'm hearing here. This is what I'm hearing here. Can we all get on a call together? What is my role as a patient to say to their doctor or their support staff, saying, how can I help this along? Is there anything that I can do to help advocate for myself for this prescription or this referral? Who can I contact if there are these roadblocks? So, for example, I'll have patients, I'll direct them to the state insurance commissioner if we're getting roadblocks with insurance that aren't appropriate. And these are ways that we can work together to fight against a system that isn't fair. And we're all on the same side. Both doctors and patients are trying to survive a system that's forgotten who it's supposed to serve. Again, I'm so grateful for my patients, and I told my patient parent, how lucky I feel that I've gotten to be a part of their lives for so long. Those long-term relationships, the trust, that's what keeps me going. Doctors still care. We care deeply. We're just tired, but we haven't given up. So together, working against a system that isn't designed for us, I do believe that there's going to be a way for us to circumvent it, but it's going to take us continuing to band together, to show compassion, to show grace, and I believe that we can do it. Thanks for listening. If this episode resonates, please share it with a friend, with a tired doctor, or a parent who's lost trust in the system. The more we understand each other, the better we can rebuild trust and healing on both sides of the stethoscope.